Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your not-for-profit community-owned hospital. This program is focusing on healthcare issues that are going to be relevant to you or family and loved ones. We hope it'll answer questions for you or give you places to go if you have those questions. So stay tuned. I've got a great show for you today. We'll be right back after these messages. Welcome back to Your Health Matters. My guest today is Dr. Donovan Schmidt. Welcome to the program.
Thank you.
It's good to have you on the show.
It's good to be here.
You've got yeah, it is. I was going to say, you have quite a story to share with us today, and I'm excited to share it with our audience as well. But first, let's talk a little bit about you and your background. And I know you, how long have you been in the Kingman area?
I started in the emergency room in 1998.
Okay, so you've been
about
at
13
KRMC?
years. Yeah, at KRMC. Mm-hmm.
And then you started Fast Track, so you partnered
Correct.
with...
I partnered up with some other people, and we started that in about 2004, 2005.
Okay.
And then KRMC purchased it about 2 years ago, I believe.
Yep, yeah, it'll be coming up on 2 years, I think,
2 years
since we
in
bought
November.
that, right.
Mm-hmm.
So you still dabble a little bit over there at Fast Tracks?
Once in a while. I quit about really doing it full-time about a year ago, but I've still done some part-time work if they need somebody.
Okay. Well, so what brought you to Kingman? I always like to ask that of our, especially of our doctors, because it's always sometimes a challenge to get them here.
I was living in Havasu City, and
hot part of the state.
exactly. And shall we say, just personal issues. Well, let's put it this way: I was working in an urgent care down there, and some friends of mine, Dr. Welch and Gachoko, had this contract up here, and they needed somebody, and so I decided I'd just take the job, and eventually, moved up here. Well, I started working here, and then in about 2002 or so, I met my wife, and so that's when I moved up. And she works here too. Yeah, she's in nursing.
Yeah, very good. So you moved up here full-time permanent.
Full. Yep. Mm-hmm.
Okay. So before Havasu and Kingman, where did you live? Where'd you come from?
I came from a lot of places, knocked around, and I was actually for quite a few years just worked the river emergency rooms, and I worked Blythe, Parker, Needles, Lake Havasu City.
There.
Yeah.
And so is emergency medicine kind of your specialty? Is that what you went to school for?
Well, I'm from the old school where
you learned it all.
Where I didn't take a residency, and so I basically did emergency work from the day I got out of med school, because I started in Parker where there was no hospital and certainly no emergency room, and back then it was quite a battleground. So my first patients came from a 7-person car wreck.
Ooh.
And that we handled in a 300 square foot office, and so it was just kind of the school of hard knocks.
Stitch them up and wrap them up, and
So,
wow.
Yeah, so we were developing transfers and little protocols long before it was that we knew anything about it.
Right.
So
that's awesome. So you've seen that whole urgent care as well as the ER side really grow.
Right, and transition, and my practices were general in nature, but I always took fit walk-ins in, and so it just never made sense to me to have someone with an acute problem wait 3 weeks to be seen.
Right.
So.
That's awesome, and it makes sense. And there is, and plus the urgent care, I think, helps relieve the pressure off of the ER so that the ER can truly deal with emergencies.
We're hoping and thinking it did.
Right,
yes.
Right. And I know we're always kind of trying to educate the public that they have that as an option. So sore throats, earaches, things like that can be seen.
Well, even possible fractures, lacerations. Even little things. Should I go to the ER? Should I not? Sometimes they're.
Can you even get stitches at the urgent care?
Oh yes.
Okay, the minor ones, So like I was saying, it saves the emergency room for those true emergencies.
For the big things.
The big ones, big ones. Which, speaking of big ones, so you ended up kind of becoming seeing the other side of Kingman Regional
Yeah.
Medical Center not too long ago.
Sure.
Well, let's start with, when did your visit to Kingman Regional first start?
Well,
when was that?
I have a part-time contract at the jail, at the Mojave County Jail now, and I'll get to why I'm saying that.
Okay.
And I was self-treating my own terrible blood pressure, and I was having side effects from the medicine, and but when I discontinued the medicine, I still had the side effects, one which was a very slow heart rate. So I had talked to Dr. Sade, and we decided that as long as I wasn't feeling ill, we wouldn't worry about it. Well, my heart rate came up to normal after a couple of weeks, and but just something told me I wanted an EKG. So I had them do an EKG on me in our clinic at the jail.
Oh,
And
at the jail you had that done.
At
Okay.
the jail I did that. So it really didn't show anything significant, just stuff that would be pretty much age related. And so I took the EKG to Dr. Sade, and he looked at it and says, well, he didn't really see anything of anything to worry about, but due to the fact we were fooling around with this, he says, let's work you up. So I had a cardiolite study, which is an isotope study where they inject your vein and then put you on a treadmill and see where the
Like a stress
isotopes
test kind of thing?
Huh?
Is that what they call a stress test?
Yeah,
Okay.
on with a stress test, and it showed that the back side of my heart wasn't getting the blood supply that it should. So then he did an echocardiogram, and it showed an area of my heart that was just sort of laying there being lazy while the rest of the heart was working. So the statement was, or the plan was, for me to go to the cath lab, and I was probably just going to need one stent
Okay.
in my
Famous
right,
last words?
famous last words, in my right coronary artery.
Okay.
And so I go to the cath lab, don't remember anything about it because of the sedation, and I'm in the cubicle with my wife waiting, and Dr. Sade shows up with Dr. Montero and says, you need more, than a stent.
Uh-oh.
You need a quadruple bypass. And
Wow.
I
So
said,
that's 4.
oh, that's
That's
4.
big.
Yep. 4 biggies. Yep.
Yeah.
And so I said, well, that wasn't my plan today, but okay. So, and then my blood pressure was very high, and so they wanted me to stay in the hospital. This was on a Friday, stay till Monday, and I would have the operation on Monday. And which is what happened.
That's
And,
kind of scary, having to wait like that too. I've always said that for myself, at least, those surgeries that were the most serious, but that happened really fast. You didn't have time to
Yeah.
think about it. But when you have
Well,
time to think about it, sometimes it's worse.
I never thought about it that way.
No?
I just
Okay,
thought,
good.
well, this is something that's got to be done. I've been around here for 13 years.
Right.
My wife and I are comfortable with being treated where we work. And so basically I was more concerned just about getting my blood pressure down than I
Yeah.
was about, and they were treating me for it. And, so I was more concerned about that than I really was about the operation.
Okay.
And so I was operated on a Monday, the following Monday. It would have been August 22nd, and came out fine. And then, but 24 hours later, I developed ventricular fibrillation, which basically your heart quits beating, just lays there and quivers. And I did that twice. So I had to be resuscitated twice.
Oh,
And
trying to give your wife gray hair.
exactly. And so after the second time, I returned to the cath lab, and Dr. Sade put a stent in a little, right by a kink where one of the grafts was.
Oh, okay.
And then that straightened me out, and then and I still had a stormy recovery. I had some post-op problems that usually you don't have. I had a pancreatitis that you see with these once in a while, but not usually.
happen. Mhm.
And then another problem was I had fluid in one of my lungs, and which is not unusual.
Right,
but
right.
It was still was a delay.
Yeah.
And so
But
that was
still,
drained.
you're talking August, which is just a couple months ago.
Right.
And you're up and walking around here with after having 4 bypasses done. That's
Yep.
pretty amazing.
Yeah. And in fact, I probably did this a little early, but I went back to work about 2 weeks after I got out
2
of the
weeks?
hospital. Yeah.
Oh my goodness.
And but I feel good.
That's awesome.
And people say I look good, so I guess that's something.
Yeah, I wouldn't have
And,
known if you hadn't
yeah.
told me, if we hadn't
And,
talked that night a couple weeks ago when we first chatted about this.
And then and then there's a nice little rehab program, cardiac rehab program, and I started that. I'm going to guess a couple weeks ago, and I'm on. I think, in fact, it'll be today. I think I'll be on session number 9.
Okay,
And there are 36 sessions.
okay, good.
And so it initially just is mild exercise on a treadmill and 2 arm exercises and then a stationary bicycle and then a couple little arm biceps exercises and a couple in a leg stretch. And so that's going well. The first day that I came in the afternoon for an introductory, and so wasn't planning on doing anything, but she just put me on the treadmill for an easy walk, slow walk for 10 minutes, and I didn't realize how bad a shape I was. And so it
Well, that's
prompted a nap.
yeah, that's
And,
major surgery, and I think even when you're in good health, to have
Right.
your body manipulated and broken apart and put back together like
Yeah,
that's
It takes a lot out of you.
it does.
And,
Recovery is huge. And I think that's cardiac rehab. What that does is kind of help you slowly regain confidence in the
Exact.
fact that your
Yeah.
body can work again and exercise again.
Right. Well, I was, excuse me, I was fortunate that I did this before I had, a heart attack
Right,
or
so
some
you
kind
caught
of
it early,
damage.
right,
So my recovery, although it was stormy, was much easier than if I'd had a heart attack and
Okay.
and the strength of my heart was
Right.
knocked out.
Right.
Also.
Well, we're going to talk a little bit more about that. I want to, I've got some other things I want to ask you about for our listeners, but we have a couple of messages, so let's hold on for just a second. Stay tuned. We'll have more after these messages.